Ladies and gentlemen, welcome to Unprejudiced. We start right now. I'm Ovidiu Damian. Thank you very much for being with us today. And I want to remember you that we have sign language interpreting for our message to get to the deaf community. There are more than 30 years since the televisions outside Romania were showing to everyone in this world the horrific images in the Romanian orphanages, and unfortunately, I'm so sorry to tell you that in some cases the situation is not very different. So as you have seen in our other episodes, we presented you such stories about these horrific institutions in Romania, and we have the Center for Legal Resources in Romania, an NGO specialized in monitoring the way that the rights of persons with disabilities and other vulnerable groups are respected in our country, and they try to monitor those institutions and to facilitate independent living for such persons. And apparently the authorities now are offended by the Center for Legal Resources and their initiative, and they want to block their access in the institutions, but they already were able to go in such an institution, and they found Silviu there. Silviu wanted to leave the institution and to live independent, and he has a very interesting story. I don't want to die in such an institution, Silviu was constantly saying, and we have a movie that was realized together with our friends Denisa Morariu and Cristi Tamaș, and we would like to present you now the story of Silviu. Silviu, the young guy, willing to leave the institution and to go into the independent living. And as I mentioned earlier, we have this movie that I would like to invite you to visit it right now. And after that, we'll discuss about this situation with my guest, lawyer Dora Calian. So stay tuned. Silviu called me last year before the Easter, and he told me that he heard about us and he wants to leave the institution. He's young, he's 21 years old, and he wants to do something with his life, and he feels that in the residential care he's doing nothing. So I told him, okay, let's see what we can do. We need documents for this, and we contact the authorities. Things were fine. But after a while, the management of the institution was changed, and was very difficult to discuss with the new management. And it was like a wall. They didn't answer my calls, they didn't answer my emails, they didn't answer my official papers. So after that, the Center for Legal Resources took the problem and tried to do something for Silviu. Things started to move again. Five months earlier. Let's go inside. This is the living. This is the dorm. So this is the free place for Silviu and Florin. They already know each other a bit, and they discuss together on Facebook, and they have a relationship already. And this is the place in PROAC Support Center where Silviu is gonna stay for a while in order to develop the independent living abilities. Yeah, his colleague is waiting for Silviu. He prepared everything for this, and Silviu spent already 3 days in our services at PROAC Support, because I told him, you want to come out from this residential care, but you have nothing about the life outside, because you don't have only rights, you have also responsibilities. You have to do everything. You have to clean, you have to cook, you have to do everything alone for your own life, and you have to understand that it's very different from what you were used to in the institution. And he came in our service, he spent 3 days, and he was really willing to leave the institution. And we are now in this administrative process waiting to be able to move Silviu. So the authorities, they refused to answer our requests, but after we intervened, and we still have problems in the communication with the authorities, but somehow we have to move the things in order to help Silviu. They are still postponing Silviu's situation. There are 2 months delay already, but we really hope that we are gonna solve the situation. Yeah, we have to help Silviu. He's thinking a lot about this, and he really wants to leave the institution and to come in this support service for independent living. They already postponed it a lot, and there's a lack of empathy for Silviu's situation, but we are gonna help him to go out. Yeah, I'm thinking about this. I'm leaving in August. I'm leaving in September, and the management told me just have patience and wait. They were telling me that everything is gonna be fine, but not yet. But they were trying to make me change my mind. So Silviu is really committed to his goal to leave the institution. The authorities that even take into the discussion that they don't have money in order to help Silviu to leave the institution, but that's just an excuse. That's just an excuse, and theoretically speaking, we should not have this kind of residential care in Romania. This is what Romania should have done. I know how it is to stay in a residential care, and I know how horrible it is how to be here. So that's why I want to live. I don't want to spend my life in such an institution. The years are passing, and you are getting old, and you are gonna die. And who is gonna take care of you? I don't want to die here. That's why I started this action, because I was very afraid that I'm gonna die in such an institution. And I don't want this. He wants very much to leave the institution, but let's face it, Silviu knows how life is inside such an institution, not outside. So it's a lot of work to do in order to prepare him for independent living. So as I mentioned, there is a lot of work to do, and it's gonna be difficult for him to adapt to the new life. The way his life was bad with problems, but this was his life. So to adapt to a new life is very difficult, and there's need time for this. But apparently Silviu is motivated to do so. Hello, hello. This is gonna be a roommate. So, how was your trip? Ah, it was good. Let me show you the room. Yes, of course I want to see the room. This is your bed? This is the place where you're gonna stay? I'm very happy to be here. I like it a lot. I think it's a wake up for Silviu because in the institutions they are in an altered state of consciousness. They take a lot of drugs, and they are not quite awake. Let's say they are just eating, taking pills, having lunch, taking pills, then having dinner, taking pills, and this is not life. It's not life. I'm very happy that I'm here. Do you miss anything from the residential care? To be honest, I'm very scared when I just hear about that place. Even though here you have to do everything, you have to cook for yourself, you have to wash your clothes, you have to do everything by yourself. I'm very happy to be here. Even if in the residential care somebody was washing my clothes, I didn't like it. I I didn't like it. I wanted to be independent. I wanted to be independent, and even when I was in that residential care, I didn't like that the others were taking care of me. And because of that situation there, that horrible situation there, I was even thinking about suicide. I was so afraid. I was so afraid that I would go back, that instead of going back in such an institution, I would commit suicide. Putting some people in institutions, that's limiting the liberties, the civil liberties. But those are privative institutions, and you don't have the freedom there. And the conditions in such institutions, they are really bad. In just few cases, in very little cases, you have very good conditions, but in the rest of the cases, they are horrible conditions. You cannot imagine the way things are looking in a psychiatrical unit. You cannot imagine, believe me. How low, how severe, how ugly things can be there. You cannot imagine. Trying to monitor in those years how many people went out from the system, I think that more than 90% of those ones going out from the institutions were then when they were dead. So then we ask why the persons with disabilities being in those institutions, they cannot ask for their rights. We had calls, we had letters at the Center for Juridical Resources, and we tried to convince the authorities to do something, asking the authorities if they need support services for independent living. And the authorities, they said, no, there's no need for such services. Thank you very much, because our beneficiaries, they get so many information and everything they need. And unfortunately, we don't have support or assistance services to make this transition from the residential care to the community services. And also in Romania, we don't have the pro bono culture. So, if in other countries pro bono is something very valued, in Romania we don't have this thing. So, unfortunately, Romania is not very different from the Romania before the revolution. We didn't have changed the things. Even if we ratified the CRPD, we were pushed by the European Union, about the other international organisms, and we did something, but we don't even understand what we did there. This psychiatrical unit is the biggest in Romania. We have 305 beneficiaries with mental illnesses, 300 for adults and 5 for children. And yeah, it's a really big institution. It's a really, really big one. And we try sometimes to offer them access to juridical services, but it's almost impossible. Sometimes we can offer them a minimum of services, but there's just minimum. So I asked for support. I asked for help from authorities, from lawyers, but nobody's interested about the situation, especially if I ask them to do things pro bono. So we tried to make a mobile unit with lawyers, with psychologists, being able to go in those institutions where the beneficiaries are, and to explain to the persons, to the beneficiaries there, how they can solve some problems, to put them in contact with NGOs, having services in the community, to facilitate the access and the coming out from the institutions, of course taking care of the wishes and preferences of the beneficiaries. And then we also took into consideration the experience we had in the USS.
Approximately 5 years ago, when it was somebody decided that we needed to be able to get out into the community, that there is a lot of people that don't know legal services exist, or they don't have the ability to get to the legal services offices, whether they have mobility issues and aren't able to travel, or they have children and it's expensive to get onto the subway. We work with a lot of different community-based organizations throughout the city and Long Island and Westchester, and so we will go to their organizations, park outside. They will tell their clients that we're going to be there, so they'll sign up their clients for different slots, different appointments, and so we can meet with their clients. We're able to park outside of court so that clients that don't have attorneys can come on and at least get some advice from us, if not representation. We're able to have clients get orders of protection from the van, so clients can come onto the van, we can do an intake with them, and then we're able to write up the petition, and then we send the petition to the court, and the court will docket the case, and then we're able to appear via video conference with a client, and then the judge is on the other end of the video conference, and we could have our case that way. Thousands of clients that we have been able to help on a yearly basis, and we have different volunteers coming every day, so we're out at least 5 days a week, and we have 4 volunteers on every day.
Access to justice is actually the core to the realization of fundamental human rights. If you have no access to justice, how can you expect to exercise your fundamental rights? And unfortunately, the difficult legacy of discrimination of people with mental health problems or intellectual disabilities is the system which denies them the legal capacity in the society.
We have to take into consideration the rights of the beneficiaries in such residential services, because we found out in our monitoring visits that there are abuses, they have violent treatments, or they were tied up on the bed, not respecting the laws. So they are tied up in the bed, they are beaten, they are sexually aggressed, psychological abuses. There are plenty of problems in those institutions. It happened in January, where employers send us messages, and they even sent us photos, and there were horror photos. I was not expecting to see such photos. We went there, and it was difficult to enter in this institution. We showed those photos to the director. He admitted that yes, they are the beneficiaries, but the management said that everything is a setup. It's a setup. It's just a setup. There's nothing true. It's that it's something that was made on purpose, and that was set up. Of course, when we were there, everything was very good, but we had information that the things are not working actually there, and the director is using the beneficiaries to build up his own house, the house of the manager. He's taking them out in the village just to help with the building. And after a while, even though in the media we presented this story, in few weeks everything was closed, the case was closed, and everything was deleted, you know. So everybody pretended that nothing happened, and then nobody was able to enter in Măciuca Center, of course. So even though we had photos and we have a lot of evidences about the situation, we had you saw beneficiaries being tied and everything. So it was very, very clear that happened several times. There were also deaths that they were undocumented, and nobody looked after this. The access to health services is also very, very poor, so that's why they develop health problems and they are dying, but nobody investigates those deaths. We've seen in other times also situations when beneficiaries tried to get access to health and to medical services, and unfortunately, because she's a beneficiary of social and residential care, the doctors refuse treat them, to make surgery or something, because they don't have very clear stipulated the legal representative, a guardian who's able to sign for her, for somebody, in order to get medical services. And this case shows us that the human right and the right of medical treatment is broken, and the right to life is not respected for those people. When you have to postpone a surgery and you endanger the life of such a beneficiary, this means that you are not respecting the right to life. Yeah, we identified such situations. That was the situation there. And the management said, there's nothing we can do. There's nothing we can do. This is what they tell to us, and they just postpone the situations. Years are passing and they just let the things go, saying, yeah, whatever, there's no emergency there. So they just let the things and postpone the things. The expression of a mentality and a behavioral stereotypical things. So the problem is the lack of representation for such persons, the lack of social network. They go in such situation where they become invisible for the society, and the persons in the residential cares, they just become irrelevant for the authorities. They cannot react on their own, so they don't have instruments to react, they don't have support to react, and nobody's reacting on their behalf. What Romania should do, and what we tried to do with our programs, was to help those persons with disabilities, to empower them and to give them information in order to take a decision. But it's very, very difficult to work with such persons being hidden and being closed for 30, 40, 50 years. We don't have the same language. They were not taken out. They don't know how a bus is, how a taxi is, what an abuse is, and what they have to do where there is an abuse. I was also in monitoring visits, and I've been in such institutions to monitor. We have a protocol with the Minister of Work and Social Protection, and for us, being an NGO, having this right to monitor, so we signed this protocol in 2013, and we had the surprise. We have the surprise that after 13 years, and now they cut the protocol. They don't want to have this protocol. So from this perspective, I think that the Romanian society is in a huge regress. We are back in the studio, and you've seen a movie in a collaboration with our friends Denisa and Cristian. And so Silviu is now a free person out of this residential care, but we discuss about the situation in the residential care and about the access to justice with my guest Dora Calian, which is a lawyer and also a monitor in the Center for Legal Resources. Thank you very much for being with us. Sasca Mică, Brâncovenești, Măciuca, Turnul Roșu are places, are residential care places that you know very well because you've been inside. What the lawyer Dora Calian saw inside those institutions. I've seen many things there, but what I can say that there is a lot of suffering, and unfortunately the laws are not respected. Many times in the residential care for others are the former children. Yes, that's true, and unfortunately the road of such a person is you are a child, an abandoned child, or a child without family, and unfortunately when you are 18 years old, then you go into an adult person, and we ask ourselves, ladies and gentlemen, how is for such a person not knowing a different life, just the life that from almost from the birth up to your age as an adult, all your life is spent in such a residential institution. As a child and as an adult, you spend your life in such a residential institution, and the only visit is maybe just a little bit in the village. Yes, it's true, this is what we have seen there. And I have to mention that the authorities, the management of such institutions, they were very angry seeing us discussing with the beneficiaries, asking them about their rights, and of course the beneficiaries, they knew nothing about their rights, and the management was not very happy that we were discussing those subjects. So what we can do, Dora? What we can do for those people? Because the CRPD says very clear what we have to do. What needs to happen in Romania for the CRPD to work? CRPD is a very good document. It was adopted in 2006 in New York, and it was signed in 2007 by Romania, and in 2010, 2011 it was ratified by Romania. But from being ratified to really work, that's a totally different situation, and we have all the reasons to apply it. We know that persons with disabilities are vulnerable, and their rights has to be protected, and the society should work and should fight in order to respect the rights of persons with disabilities. Disability is not an illness. Disability, it's a social question. It's a social problem that involves everyone, and we have to look at the intersection between the person with disability and the society, and then society has also responsibilities regarding the persons with disabilities in terms of services, in terms of support for such people. We have to inform our viewers that when we were at the United Nations headquarters, we celebrated there 10 years since the CRPD was born. And I want to tell you, ladies and gentlemen, that in the big hall at the United Nations, in this ceremony, we had UK, we have United States, Mozambique, Kenya, but Romania has no representatives in that committee there. We hope we'll have in the future a very diplomatic answer, and I want to ask you now, Dora, why in such residential centers we talk about guardianship, and I would like to ask you to tell us what guardianship means and why we don't invest in supporting decision making. Why we have this problem? Unfortunately, as I mentioned earlier, unfortunately, the beneficiaries are former beneficiaries as children, not having families, so nobody's taking care of them. So this creates a lot of strange situations. We saw earlier Mugur Frățilă in the movie. He was talking about that woman, very, very strange situation, a woman being in the need for surgery, but nobody could sign for this surgery because of this lack of guardianship and support in decision making. And yes, I was there with Mugur, and the lady was desperate. She was crying and she said, I need this surgery and I need somebody to sign for it. And in that situation, from my point of view, if we would have had this assisted guardianship, which is very well regulated by the CRPD, we wouldn't have been in that situation and the woman could have benefit of the surgery. You asked me what this guardianship means. And I would like to ask you to explain us a little bit more. And yes, this procedure of guardianship is a juridical procedure, and then of course the authority as a protection mechanism, we would take a representative, a person taking care of the vulnerable person of the beneficiary, will take decisions on behalf of the person, will report to the authorities, explaining everything that the person did for the beneficiary, so it's going to be also controlled by the authorities. So as a juridical vision, it's a good thing, but unfortunately, as Georgiana Iorgulescu mentioned, in the Romanian legislation, the Romanian juridical system, this doesn't work very well, because usually in Romania you have just the two extremes. If you put this guardianship, then you eliminate the juridical capacity, and this guardian will decide just totally decide for the person of for the beneficiary. So we don't have this, I don't know, we don't have this opportunity to have just partial guardianship. You just have this guardian deciding everything for you. So this assisted guardianship would be the best solution in Romania, but unfortunately it's not working. So when we discuss about that case of the lady with the surgery, would have been so needed this guardianship, and we made an official paper to the management, and we said that that's a huge break of the rights to medical assistance, and you do nothing for 5 years. For 5 years this lady was waiting for a signature, and then you have to go again to the doctor and to explain to the doctor there's no need for a signature because she is not under the guardianship, so she could decide on her behalf. Do you have an answer to your official paper that you have done it? Yes, it took a while. It took a while until the answer came, and I have to tell you that I couldn't imagine such an answer sounding like this. Sounds like this. We inform you that we took into consideration your request. We took the beneficiary to the hospital, and the lady is refusing the surgery. So here is the declaration. So I was shocked. shocked. I went again to ask them how is this possible, because we talked to the lady, we talked we talked to the lady, and she was really willing to have this surgery, but after that she got scared because nobody was there with her. They convinced her that she's not ready for the surgery, and they convinced her that it's very dangerous for her to have the surgery. So in the end, the lady, she admitted that she doesn't want this surgery, and she doesn't want the medical treatment. We discussed and we saw in the movie about the Machuca case. It was a huge scandal. We presented this problem in Machuca. And you've been to Machuca. You saw Machuca. What happened? Yes, I've been there. I've seen the situation there. And at this moment, we would like to take Machuca Center in the court, because that's a very, very big problem there. And now we say hello to Senator Alexandrescu, which is who will talk with us, and thank you very much for being with us today. Mr. Senator, you are trying to reach such residential institutions, and you are presenting us on Facebook the situation that you face in such institutions, and I know that you have difficulties talking with the beneficiaries there. So you try to see the rights of the persons with disabilities, but you have really big problems. Yes, it's true. It's true, you saw about my attempts to have visits in such institutions. I tried to discuss with the management, with the specialist, and also with the kids. And yes, in Bucharest I had problems with the access into the residential centers. I was not let inside, and I informed them that I would like to visit. And in another place in Bucharest I managed to enter, but after a while, when I tried to go again, I was not let to go again in the center. So besides this, I want to make a big report about my visits there, about the residential care and maternal assistance in Romania, and those topics represent a priority for me. Of course, there are also places where the things are very good, but unfortunately, in many other cases, we have the system against the beneficiaries, and the mentality is still very, very bad, and I've seen many times the situation that the child is there just to justify the system, and we don't have the system there to work for the child. So this is a shocking perspective, and we've seen this many times in our interviews at Unprejudiced. So then why we mention them as being beneficiaries of what? Yes, it's true. So I would like to tell you a bit more about my report and about the conclusions of such a report that I will discuss with the management of the institutions. And one of the conclusions is that the number of the children having psychiatrical treatment with really severe medication, with, I would say, abusive medication, and because of such a long long-term medical treatment without any evaluation and monitoring. They are kept for years on such treatments, which are very, 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 very bad for them. And in such problems, they have problems at school. They just sleep in the classrooms. They cannot pay attention in the classrooms, and of course they in the end abandon school. After that they get in the special education system, even though they are not disabled. So the system rejects them, which is an educational end for them. And then, of course, it comes with the refusal of the social integration in such situation. You were telling us a little bit earlier about the report. What kind of solutions could you implement, or maybe at the system level, some institutional services or legislation according to the conclusions, the very rapid changes that can be implemented after your report in order to improve the quality of life of the persons? What can you do with this report? I really hope that I will be able to determine the causes of those problems. We are talking about 57,000 children in Romania, and from this number, many of them, they are in the residential cares. So at the very beginning I would like to see the causes, and then on the other hand, of course, I will try to draft some control objectives, because those institutions, they have to be controlled, institutionally controlled, and after that, the change of legislation in order for the child to become the main person in this system and to benefit from services, not only benefits, but also services, in order for a real inclusion. The system has a lot of money involved for those kids, but the question is why the money, they don't reach the child, they don't get to the child. So we have to see what happens with those money and to change the destination of the money in order to really help those kids. So we have to see if those funds are getting to the child or they are used in different situation, which is illegal. All the residential cares in this country, in all those countries, I've seen only two cases in which they have psychotherapy, and those psychotherapy sessions are made by NGOs, not by the personnel in the center. So only two cases from all the beneficiaries in Romania, and the therapies are made by NGOs. And this is a very big problem, not having psychotherapy services for them, and counseling, psychological counseling for anxiety, for distress, for trauma, that could be addressed via psychotherapy, and not being addressed. In my opinion, this is a crime. So we wait your report, Mr. Senator, and we would like to see those changes, and thank you very much for being with us today, and we would like to discuss again this situation. So thank you very much. Dora, it's our last minute, so you had an experience like this in the United States, where the things are different. Tell us a bit more about this. Yes, it's true. In the United States, the situation is different. We had a study visit there, and we've met attorneys, lawyers, judges in New York, and we also have seen the NGO, the NI-LEG, and what we have seen there, it's kind of different. They go on a common law system, but besides those differences, what can I say? I would say on the society level is you see the respect of the society for the vulnerable groups, because the disability rights are human rights, and the final is life with dignity. Dora, thank you very much for being with us today, and thank you very much, ladies and gentlemen, for being with us.